Jose Barreau had a fairly typical Cuban-American immigrant upbringing, and he followed his father's footsteps as a physician. He was impressed by his mom's oncologist, whom he met in his early 20s, and this experience helped him make the decision to specialize in the treatment of cancer. Dr. Barreau co founded and directed a major cancer institute in Ohio, which emphasized collaboration in clinical practice for the benefit of patients. But he became frustrated by the communications challenges, and he looked far and wide for a solution. But finding none that met his needs, he co founded Halo Health, which provides a cloud based solution to unify all communication channels for efficient role based collaboration. It's designed for clinicians and by clinicians, but it yields a strong technical and financial return on investment. I'm David Williams, host of the Health Biz podcast and president of Health Business Group, a strategy consulting firm that helps healthcare companies like Halo Health develop robust growth plans. Reach out to me at dwilliams@healthbusinessgroup.com. Jose Barreau from Halo Health, welcome to the Health Biz podcast.
Thank you very much. It's nice to be here.
So we'll talk soon about the halo that's surrounding you now, but let's go back in time a little bit, and I'd love to hear a little bit about your background, your upbringing. What was your early life like? What were your childhood influences, if you can recall them?
Yeah, well, I grew up in Fort Lauderdale, Florida, Cuban-American, second generation, born in the United States, but my parents came from Cuba. In the early 60s. My dad was in medical school and had to leave and finished up outside of Cuba. But really, I grew up in a typical Cuban-American household. If you don't know what that is, it's usually your grandparents living there. A lot of influence in, Cuban culture, Cuban food, Cuban music. And really, it was Cuban food, music on the inside. And then when I went outside and played with my American friends. So I quickly became 95% American and still have a little dormant, Cuban genes that can come out and expand if I'm in the right environment.
Yeah, very nice, very nice. Well, for better or for worse, this is not the right environment. So feel free to let loose, but nonetheless, I may not. I don't think I have any Cuban connections. So except some other podcast guests, actually. So
I'll keep the salsa dancing
how about?
to a minimum.
Yeah. Well, listen, we're always looking for a good visual effect, so maybe I'll plug something in. So the next question was really about, why did you decide to study medicine? And maybe that's already encapsulated in the first answer about your influences. But why medicine and why a particular specialty that you chose?
Well, my sister's actually a gynecologist, oncologist, and she had a stethoscope around her neck when she was 6 years old and walking around the house. So everybody knew she was going to be a doctor. My father was a surgeon, solo practice, worked very hard, and didn't get to spend a lot of time with him because he was working all the time. But he was my main influence in terms of upbringing and kind of work ethic and those types of things. And then, I think oncology really, my grandmother got lymphoma, and I remember going to the oncologist with her and saying, wow, this is really interesting stuff. This is really impressive, and just kind of really looking up to the oncologist that was treating her. And this was in my early 20s. So I made the decision fairly late in life. But really, oncology was just so interesting to me. The science, it was so fast paced, a lot of research, and it just caught my attention over anything else.
It's certainly an area that is top of mind, and so often fatal illness, cancer that people have. But it's also been one where there's been tremendous amount of investment and lots of progress, really, in an area where you can look at the cost of medicine is certainly very high, and that can be debatable. But there's all these different areas that have gone on in oncology, probably since you actually made that observation that it was an interesting place to get into.
Yeah, I mean, when I joined practice straight out of fellowship, I remember talking to our older partners who were in their 60s. They had one or two choices of chemotherapy. It was a very dismal thing to be diagnosed with cancer. Very few people, they didn't have good supportive medication. There was a lot of nausea with treatments and those types of things. And really, when I joined practice, in the molecular era was already on its way. There were, antibody therapies developed. There's a lot better supportive medication to prevent nausea and vomiting and pain, and just a lot of better treatments. So tremendous progress, a great time to be in oncology. When I started getting into it, a lot of money for research, a lot of new drugs getting approved. So it definitely has made a tremendous gains just in short years.
And so in the years that you were in practice, I mean, are there any things that you're particularly proud of? I mean, certainly just the whole practice, I'm sure, would be in that category, but anything that kind of stands out as accomplishments. And then on the other side, any regrets from practice as you look back on it?
Well, I practiced for I practiced for a couple of years of private practice, but then I got together with a health system to create cancer programs and really a cancer institute. And that I'm very proud of that. We created really one of the leading cancer institutes in Southern Ohio, treats the most patients in Southern Ohio, and developed multidisciplinary clinics where patients would come in and see all their oncologists together: surgical oncology, medical oncology, radiation oncology. I created the scientific review committees, the genetic program, really got it really cooking, and I'm super proud of that. But it led me to, where I am today in really understanding the benefits of collaboration. When you get a care team around a patient and they're making decisions together, the power of that for the patient is immense, and it wasn't happening enough. And mobile apps were developing at the same time. Really, the iPhone came out in 2007. We all had Blackberries, and actually Halo Health, created mobile apps for Blackberry at first, and then evolved obviously to iOS and those things.
Yeah. So talking about iOS and talking about Halo Health in particular, what was the problem you were trying to solve? And I think I'm already getting a sense of it from what you were describing in terms of the collaborative practice that you had set up
Mm-hmm.
before. But what was there, like a specific thing that you said, this isn't out here in the market, and I need to start Halo Health in order to go after it?
I remember very specifically just walking through the halls of the hospital and saying, I can't get in touch with anybody. I'm trying to get in touch with this physician. I can't do it. I don't know who the nurse is taking care of this patient. And just spending a lot of time trying to gather information and communicating with people. And I remember very clearly saying, somebody has to solve this, and we can start solving it right now. And that's really the impetus, is just solving our own problems and my personal problems that I saw that just as damaging patient care. When I saw that, if I talk to, all I need to do is talk to a doctor for just a couple of minutes to ask a couple of questions before
Yeah.
I assign this therapy, and I couldn't do it. So the patient had to wait
Hmm.
around, or maybe I did it without knowing the full scope of what was going on with the patient, and it was very frustrating. So it really, big problem.
So a lot of people have seen at least some sort of similar problem. They may not have come at it the way you had in terms of really looking at collaboration first and then saying, where are the tools? But if I think about a company like Vocera, which is maybe more has kind of the hardware side, or Tiger Text, um, help me understand where Halo Health fits both in terms of kind of the time frame of the evolution, because
Mhm.
you may have been before some of these, and then how you fit relative to them or maybe others that are in the space.
Well, for Vocera, historically it was a hardware company creating, kind of walkie-talkie badges and those types of things, and it was very nursing focused. So it's been
Yeah.
around, for a long time, and it really did other things in healthcare too. They do it for nuclear plants and that kind of thing. And companies like Tiger, they really didn't start with healthcare. They started kind of with
Yeah.
vanishing messages and those types of things, and kind of got into healthcare sideways. For us, we took a holistic approach from the beginning. We said, communication has to be system wide, has to be all the users. It can't just be nurses, can't just be doctors, can't just be sprinkled around. It has to be a mission critical
Hmm.
platform that everybody has to be on. And so we quickly found out that, it's healthcare is very different in communication and roles, because it's not individuals. A lot of times you're communicating with roles. You don't know who that person is.
Yeah.
I know that I need the cardiologist on call. I know I need the nurse on the charge floor or the ICU. I don't know who the name is. So a system like this has to really understand who's behind the roles. And that's the magic. We started thinking about how to manage these roles and get information to the right people at the right time.
And so how did you develop it into a company? Like you knew that you wanted to do a company as opposed to, ask somebody else to solve this problem, go to an existing vendor. And did you have that? And maybe this is the 5% Cuban-American, entrepreneur that you're going to go ahead and just jump on it, regardless of whether you had the business training or not. But how did it actually become a company?
Well, I did look around for a solution and I couldn't find it. So I talked to the administration. I was close with the administration. We created this merger with cancer and all that. And I said, I'd like to create this and I'd like to develop a company on it. And they allowed me to do that, to innovate and kind of keep the IP and create kind of a research center for communication and collaboration and wrap it around with software. And so that's how it started. And then in 2015, we just got tremendous traction, and I had to make a decision. Am I going to give this to somebody else to run, or am I passionate about this problem and solving it? And so I decided I'm passionate about this problem. I'm going to go for it, and it was a very difficult decision. Obviously, I was director of the Cancer Institute, and had clinical patients I had to walk away from. It was very hard, but that's the decision I made in 2015 to run with it and solve the problem. And that's really when it
And
became a
so,
company.
yeah. And did you have co-founders as well, or are you the
I
principal
did.
one driving it forward?
I was the principal in driving it forward, but I do have a co-founder, Amit Gupta, who's also a medical oncologist, who we became very close friends in fellowship at University of Cincinnati. And we really thought through this idea together and worked very hand in hand and kind of developing it over time. He still practices medicine. I took the business route, but he's on the board now and gives a lot of good input.
Great. And so what is it that you're actually offering, and how has that evolved since 2015? And I just threw out a couple of,
Mhm.
example companies that I think about kind of in communication, but how have you evolved, and how do you fit in with the rest of the ecosystem these days?
Well, I mean, the best way to describe it is there's a clinical information layer across health systems, right? And which were really consolidated by the EHR. You're talking about documentation, revenue cycle management, all these types of things, mostly on-premise systems. And then there's this clinical communication and collaboration layer that sits above it that's very fragmented. You could consider maybe Vocera has some badges in there. Tiger Text may have some apps somewhere in there. There's some scheduling stuff. There's pagers still there in a lot of places. So what we're
Yeah.
doing is we're taking this clinical communication collaboration layer and consolidating it on one cloud-based platform. And so we take this and we consolidate on one platform, all users on mobile apps or desktop apps, right? And then all the messaging, the calling, the real-time information, integration with the electronic health record to pull out real-time information. So only what
Yeah.
you need to make a decision and actionable. Everything else can live in the EHR or whatever system of record. But this is the real-time flow and communication of information across the health system. And the magic also is it's not just the system, it's the community. When you have cloud modern
Mhm.
architecture technology, it flows into the community. And as hospitals are expanding, it makes it easy for them to, we call it expand your halo to other organizations, affiliated physicians, those types of things. So it creates a network effect, right, of this infrastructure.
I think one of the complaints that physicians specifically have about electronic medical records and some other sort of systems that are imposed on them, and it's sort of like what an administrator thinks a doctor should be doing or should know about, and what a nurse should have. And I do note that both you and your co-founder, as clinicians, are really coming at it from the patient care and clinician standpoint about like a specific problem that you actually have, not a problem someone told you have or that they'd like to have
Yes.
oversight on.
Mm-hmm.
And clearly others too, including the other companies that I mentioned, have incorporated that. But I think there is something about kind of the DNA of a company that's really a doctor who had a problem, and they're going to resolve it from their standpoint as a way to aid the patient.
I think that's very true. We call ourselves, we have clinical DNA. We say that a lot. So, we created, we solved the problem for doctors and nurses and thought about it very clinically and are backing into the excitement to the CFO and to the CEO and the ROI that they get. It wasn't our primary driver. Our primary driver was improve patient care and make doctors and nurses' lives better. But we know to sell this thing to the health systems, it's got to have a financial, a technical return on investment for the CIOs and the CFOs that are making decisions. So we back into that by doing this. Then we're showing that versus a lot of healthcare that don't have clinical DNA and may try to solve the financial ROI problem first and then worry about the clinicians later. And I think that may create poor user experiences and some of the burnout and things we're experiencing now.
Yeah. So now, as you back into that, then what does it look like? So how do you sell it to that CFO or CIO whose budget it may very well be coming from?
So, fortunately, over the past 6 years, we've been able to put some fairly large health systems on our platform. And what you find is, number one, is we have two types of return on investment. There's a technical return on investment, where you have the latest cloud technology always updated in real time, and you can get rid of some of that older infrastructures of pagers, scheduling systems, things like that are there. So there's an ROI around consolidating, around FTEs to manage all these disparate type of technologies, security, right? We handle all that, upgrading it and everything. And then the clinical ROI on it, when you talk about length of stay, when you talk about increasing referrals, increasing alignment between physicians, there's many health systems that the physicians that are employed don't even know what services they offer. They don't know what physicians are associated with their hospital system. So when you put someone on a real-time platform and create those connections, it really increases that alignment and increases kind of the visibility of the services the health system provides into the community also. So there's an ROI around that. And there's an ROI around stroke, right? We'd have a lot of critical teams, door to needle times, door to balloon times, all these types of things. So there's a whole variety of clinical return on investment and technical that we can actually prove and show to the CFOs, the CIOs, and the CEOs.
So I don't want to read too much into this, and I don't want to put words in your mouth. But if I think about what you mentioned about the community that you're building, and also the fact that this is a role-based system, and also just
Mm-hmm.
thinking about the physicians, including how committed your father was, and how physicians a different thing than just a job.
Mm-hmm.
And you are making life and death decisions, and you have to rely on somebody that you might not know. Now, you know the role, and you know that this person is an anesthesiologist or emergency room doctor, whatever it may be. They have to have been selected competently. You have to have trust in their training and what they're looking out for. And then if you actually kind of connect over this way, it's not like you're necessarily going to get together in person and you went to school with them or whatever. You actually have to kind of have that trust and have the community that is then supported with the technology. So it's a different than like a Facebook or something like that, because it's kind of based on these roles, but you're creating this community, and then presumably you can get that kind of outcomes for the
Yeah.
patient that you're looking for, and then that has a reinforcement. But help me say
Yeah.
that better, because that's just me as the
Yeah, well, it's certainly true that you can communicate and interact with roles, but you always know who's behind the role once you initiated communication. So our system
yeah.
allows you to know who you're communicating with, who you're sharing information with all the time. So initially, you may not know who's in that role, but once you're interacting, you find out who's in that role, and our system lets you know. So it's not blind like that. And kind of historically, physicians want to send patients and want to work with physicians who are the best or who they know are going to take really good care of their patients.
Yeah.
And so this type of a network allows you to kind of evaluate who you want to work with better. Who's responsive to you? What kind of answers are you getting? The communication flows. One thing that happened with electronic health records, I implemented electronic health records in my system, Epic, which is great, but it keeps everybody in the computer and copying and pasting notes, and nobody interacts and collaborates around patients. They're just sharing notes back and forth, and it's so that really did not improve communication and collaboration. Improved documentation, revenue cycle management, some aspects of patient care, but this did not benefit. So you really need that touch, to get in touch with people and that interaction to evaluate people. Otherwise, you're evaluating from 3 lines in a note, and you can't tell how good people are for that, how responsive and
Yeah.
how their decision making is.
So where do we go from here? You're still a young company. We've obviously been through a pandemic and still going through it to some extent
Mm-hmm.
now.
Mm-hmm.
But what does the next few years look like for Halo Health?
Yeah, I mean, we've been very fortunate. We started the company and funded it ourselves, but in 2017, we brought a great partner in Bain Capital Ventures in, who's just been fantastic and kind of helping us think through where to go and been really supportive and really allowing us to build our vision. So our vision really is to create really the biggest network, amongst hospitals, get hospitals on Halo and have them share and expand their Halos to the community and make the real-time sharing of essential real-time information really easy, get doctors and nurses to have what they need in the palm of their hands when they need it, right? And use the EHR and use the other systems to get that information there. So it's just really exciting. Really, we want to be that digital foundation. You can plug Alexa in, you can plug other things, right? Internet of Things inside of our architecture to get it to the right person at the right time. So as health systems expand their digital footprint, we want to be there expanding with them and be kind of that foundation for real-time communication.
Now, I guess Amazon was paying attention because they have this Halo band now. So did you feel like they're like stealing your thunder with that Halo?
Actually, we're very close to Amazon. We did an AWS Life Sciences webinar with them, and we knew this was coming before it, and we didn't really see any problem with it because they're very consumer focused,
Yeah,
and we're not at all. So you can't
yeah.
just download our app from the store. You can, but you can't do anything with it. You really need to be provisioned through a health system. So there really was not any confusion about that. Now we'll see down the road, what happens, but we have a very collaborative relationship with them, and so we really have no problem.
No, it sounds good. So last question, that something I ask all of my guests is about reading. Any time for reading, and any books that you would recommend or recommend that we stay away from?
Well, I do read quite a bit, and I don't necessarily read business books all the time.
Yeah.
A business book I read recently was Ray Dalio's Principles, which I liked a lot. It's very black and white, and it's just fun to watch somebody who's been very successful and the principles they use to build a business and some in life. So I recommend that book. It has a lot of things about machine thinking, which is helpful in simplifying
Hmm.
things. And on the other side, just read, Walter Isaacson wrote a book on Benjamin Franklin. It's not new, but I recently read that. Bring back the Cuban-American, but this guy was an amazing person, and it brings you back to kind of some of those founding principles on how innovative they were and how incredible someone like Benjamin Franklin was at that time. So both of those books very different, but I thought both were very good.
No, it sounds great. We've had Isaacson recommended before as an author, but not that particular book. And the Dahlia book is a new one here. Most people have the same thing. Entrepreneurs usually recommend The Hard Thing About Hard Things. I think most of the like half the
I've read
people on the
that.
podcast have recommended that.
Love that
Yeah,
book.
I figured. Yeah,
That's a
I
great
read
book.
it too, but it's okay.
Read that
Yeah,
a long
we
time
don't
ago.
need that.
Yeah.
Yeah, exactly.
Leonardo da Vinci
Yeah,
biography. So that's another good one that's
I
coming out.
heard
That came out.
I heard about that one, and I'd like to read
Mhm.
that one. Da Vinci's absolutely fascinating. It certainly rivals Franklin, if not exceeds him. It's amazing what people
Mhm.
in that era could do. If you think, especially like in your field, you think about kind of the level of subspecialization that people do, and then you look back to a Franklin or a Da Vinci. It's just a different world. I don't know
It
what
is
they
a
would be
different
doing,
world.
if they were here if they were here today.
You're right.
In any case. Dr. Jose Barreau, co-founder, chairman, and CEO of Halo Health, it's been a pleasure having you on the Health Biz podcast today. Thank you so much.
Thank you, David. It was a pleasure.
You've been listening to the Health Biz podcast with me, David Williams, president of Health Business Group. I conduct in-depth interviews with leaders in healthcare business and policy. If you like what you hear, go ahead and subscribe on your favorite service. While you're at it, go ahead and subscribe on your second and third favorite services as well. There's more good stuff to come, and you won't want to miss an episode. If your organization is seeking strategy consulting services in healthcare, check out our website, healthbusinessgroup.com.